Most of us would have had a bleeding gums or a bleed from the gums at least once in our lifetime. What is the reason for this bleeding gums and why this bleeding gums happens? Let's see. I am Dr. Muthukumar and I am going to explain to you the reasons for bleeding gums and how to treat bleeding gums. So generally, bleeding gums happen when the food accumulates in the region of the gums and causes swelling of the gums and redness of the gums. So when this redness or swelling of the gums happen, even if you use a soft toothbrush, the bleeding gums will appear. So other than this, what are the other reasons for bleeding gums? Some systemic diseases like immunosuppressive therapy for cancer, antihypertensive drugs for treating blood pressure, and certain other drugs. When these drugs are taken, these drugs can cause swelling of the gums and it can cause bleeding gums. And another reason for bleeding gums are mouth breathers. Some people, instead of breathing through the nose, they may breathe through the mouth. So once they breathe through the mouth, they will get dryness of the lips, they will get dryness of the gums, and this dryness causes the gums to bleed easily. So this has to be corrected. And another systemic factors and hormonal factors which cause bleeding gums are conditions like pregnancy, puberty, vitamin C deficiency. So these conditions can also cause bleeding gums. So how can you prevent and treat this bleeding gums? So if you have bleeding gums due to accumulation of food and swelling of the gums, you have to clean the food debris by a dentist using a procedure called scaling, and then you have to do a proper brushing. So this can be prevented. If the bleeding gums is due to intake of drugs, this drug can be modified. Another class of drug can be given to treat the whichever disease you are having. And if the mouth breathing is the reason for bleeding gums, mouth breathing has to be corrected with the use of orthodontic and myofunctional devices. And if systemic conditions, for example, if conditions like pregnancy, puberty, hormonal factors are the reason, this cannot be treated or prevented as such, but the bleeding can be minimized with the use of proper oral hygiene. And vitamin C deficiency, they have to intake more vitamin C. So with this all treatments, the bleeding gums can be reduced. So I hope this video was useful to you. If you like this video, please do click the like button, share this video and subscribe for the channel. Thank you.